Hi everyone, this is Dr. 𝒂𝒊𝒏𝒿 with Greenwich Chiropractic, and we've been talking in this video series about hip pain. And we're going to go over why we take x-rays on people with hip joint pain and the reason for that. And what we know is that an arthritis or degeneration is a large part of hip joint pathology and cases. And so what we want to do is show you a film to identify the reasons not only why we take the films, but to help understand the condition better so that we can appropriately treat it. So we're looking at a film here. This is a low back and a pelvis, and we're gonna focus on these two hip joints here, okay? The right hip joint and the left hip joint. Now, when we look, he's got arthritis in both, but there's one hip joint that looks a lot worse than the other. So when we're looking on the film, what you can see is the ball of the hip is nice and round and smooth, and we see plenty of space between the ball and the hip itself, the pelvis, and there's plenty of wiggle room in there, okay? Now, as we move over, what we can see is that there's a bunch of things happening here, right? So this hip joint space is a lot more narrow. The bone is chunkier, it's modeled, and if you look at the femur head and the ball of the femur, you can see that it's starting to deform or change shape. And what we know is that happens over a period of years, but because that hip joint starts to degenerate, the way that it moves in the cup itself, it's an inflammatory process. So you can feel pain when walking, especially when getting up for periods after sitting for a long time, because this hip joint is just so compressed and degenerated and really arthritic that it's preventing things like proper range of motion. And what that does is it pools swelling and inflammation in the area, and that exacerbates pain. And so what we know is that by taking films, we're able to see exactly what the problem looks like. So not only, number one, can we treat it appropriately, but number two, we also work with a lot of providers in the area to be able to say, okay, this is something that may require surgery, or this is something that we can take care of here in the office. So we see a big difference in both of these hip joints, and x-rays are a really great way for us to identify what exactly is going on in that joint itself and where the worst damage is. And by doing that, we can focus, we can target the care to be able to appropriately treat the issue. So when it comes to hip pain, this is a big factor in why in most hip joint pain cases, we're gonna be taking some x-rays, because to see is to know, to not see is to guess, and we're never gonna make guesses when it comes to your health. Thanks so much for listening. I'm Dr. 𝒂𝒊𝒏𝒿. We'll see you on the next video.